Now, a lot of people really struggle with hip impingement or pain at the front of the hip, particularly when they're going down into like a squat position or a lunge. So they might be sort of on the way down and about here it pinches. I used to get that all the time. Now, what people tend to do is they might stretch their hip flexors out, they feel good for 5 minutes or for the rest of the session, and then they go on for years and years with the same problem. But what they're not actually considering is the way that the hip socket is actually oriented, okay? So more specifically, how the femur or the upper leg bone sits in the hip joint, in the pelvis, and how that's actually affecting the way that they move when that leg comes up or when the pelvis goes down when they squat. So if you lift your leg or you try to bring your knee to your chest and it pinches and it causes pain at a certain range of motion, the lowest hanging fruit for you is not to just stretch your hip flexors because that's a symptom. The lowest hanging fruit is to address the relationship between the pelvis and the femur or the upper leg bone to make sure that there's a little more space for you to move so that you're not just hitting your end range in the joint and so that you haven't got the femur just basically running out of space during movement like lifting the leg or going into a squat.